Planned coitus with monitoring. What is planned coitus with monitoring? Planned coitus, also known as timed intercourse cycle, is a method of optimizing the reproductive window of a patient by stimulating egg production in the ovaries, inducing ovulation, and increasing the chances of natural conception with the help of medication and continuous medical monitoring and assistance. Planned coitus is a low-intervention treatment approach. Women who have irregular or absent ovulation, hormonal imbalances during the cycle that cause spotting, blocked fallopian tubes, healthy uterine cavity, male partner does not suffer from infertility, unexplained infertility are good candidates for a planned coitus cycle. A woman is fertile for about 5 days before she ovulates until 24 hours after ovulation during each monthly cycle. The ovulation window is a 6-day period during which the sperm and egg have limited amount of time to survive. These are the 6 days in a woman's menstrual cycle when she has the most chance of becoming pregnant. Intercourse planned to coincide with ovulation will increase conception rates. Step-by-step guide to planned coitus with monitoring. Step 1. Stimulation. Certain medications are administered for the formation of one or more mature follicles in a woman's ovaries. These medicines block estrogen receptors, causing the body to believe that estrogen levels are low. This causes the brain to release a hormone called follicle stimulating hormone (FSH), which causes ovulation, the release of one egg, or superovulation, the release of many eggs. This assures greater the possibility of conception since more eggs produced in a cycle. Step 2. Control. Ultrasound scans of the pelvis are being used to examine the endometrium, womb lining, and evaluate how the follicles are developing. Using ultrasounds to monitor the procedure throughout increases the chances of success while reducing the chances of twins and more than twins. More aggressive medications such as follicle stimulating hormone in the form of once daily injections can be given for some women who are resistant to ovulation induction with oral tablets with careful monitoring. Step 3. Monitoring the ovaries. Ultrasounds and blood tests will be performed every 2 to 3 days to evaluate follicle growth and confirm that everything is going smoothly. This allows your doctor to assess how many eggs are growing, and if any excess quantity is likely to ovulate, the cycle may be discontinued. The goal is to have a singleton pregnancy rather than a high-risk multiple pregnancy. Your doctor is also keeping an eye on egg growth to determine the optimal time to give you a trigger injection to induce ovulation. Step 4. Egg release. An HCG injection to induce ovulation, the final maturation of the egg, and the releasing of the egg from the follicle wall follow ovulation induction cycles. Step 5. Planned intercourse. The couple is then recommended to have intercourse according to the doctor's ovulation scan on suggested days. Step 6. Progesterone support. Following the planned intercourse, a patient may be prescribed daily supplementary progesterone, usually in the form of a capsule put twice daily into the vaginal canal to help the uterus, endometrial lining, and embryo implantation. Ovulation induction is frequently combined with other reproductive therapies like in vitro fertilization or intrauterine insemination that gives much successful cycles. However, ovulation induction with planned coitus alone has proven to be a beneficial reproductive treatment. Ovulation induction regulates ovulation and provides a regular menstrual cycle for our female patients. Patients can time intercourse to offer themselves the best chance of becoming pregnant once ovulation has been regulated. Sperm can survive and meet up with an egg for fertilization for around 5 days after sexual intercourse. Patients frequently opt to have intercourse every other day during the most viable window of ovulation, since sperm may survive for such a long time, because successful conception is primarily dependent on planning. This procedure can significantly increase your chances of becoming pregnant. Also, this is one of the most simple and cost-effective treatments for assisting a couple in conceiving a child. Next steps of the planned coitus with monitoring. Pregnancy test is taken 2 weeks after ovulation. Another cycle, optional, may be pursued with adjusted medication levels in case the cycle is unsuccessful. IUI or IVF based on patient's individual diagnosis. A pregnancy test is conducted 2 weeks after ovulation. Because of the hormone given via the trigger shot, pregnancy tests conducted before 2 weeks may report a false positive. If a cycle fails, a new cycle with different medication levels can be tried. After no more than 3 planned intercourse cycles, patients are often ready to go on to more extensive treatment alternatives. Depending on your specific diagnosis, the next stage in treatment could be IUI or IVF. Throughout this process, your doctor will take great effort to share all of your alternatives with you and their chances of success. More informed chances for a couple to have planned sex of during the most viable window of ovulation.